advanced nurse practitioner. You look after men with prostate cancer. We're here at the 11th National Prostate Cancer Symposium, and you've been leading now the third nurse meeting. How did the nurse meeting evolve?
There are a lot of urology nurses in Australia, but it's becoming more and more common for nurses to become involved in specialising their care, and the needs of men with prostate cancer are not always able to be met just through the mainstream services that are offered. And so a lot of nurses are becoming quite specialised in looking after men with prostate cancer. And so we decided to devise an educational program to support the nurses looking after those men. So it grew. The first year we had about 30 nurses attend. This year we have over 120, so it's clearly a growing area.
Fantastic. Closely work with patients who are newly diagnosed with prostate cancer. What can you offer patients who have this new diagnosis?
Okay, well, often at the time the patient's just completely shell-shocked. They've heard the word cancer, they come reeling out, they've got the diagnosis, they're given some information to take away, but they just don't know what to do with it or what to make of it. And often they just don't even take the information in. So in the practice that I work, once they've seen the urologist, the patient will come and see me. I will actually make sure he has appropriate information to take away with him and suggest that we're not going to have a long discussion at that point in time. They need to go away, let them filter the news that they've just received, and when they're ready, come back and talk with me, and I will then go through it in much more detail and answer the many questions that they will have thought of in the interim.
Prostate cancer in one way is a peculiar disease. Most patients, they come to their physician and the specialist nurses expect to be told what the management will be. Now, that's not always the case. They have a discussion on what options they have. Yeah. So how do you help patients make these decisions?
Exactly. It's a terrible time for patients trying to make that decision because they do have several treatment options and none's clearly better than another. I try to make sure that they've had good information by the urologist, which is usually the case, but also that they know that they can go and talk to other specialties such as radiation oncology if they want to. But making a decision, it's a very difficult time. A lot of patients really struggle with that to the point where they can sometimes become almost paralysed. They just keep gathering more and more information in, become overwhelmed with the information they have, and it's not always good quality information, and so that can also make the decision-making process even more difficult. So if I see that's happening, I'll try and direct them towards good quality information, perhaps tell them to stop getting on the internet. The next site they visit is not going to give them the perfect answer. They just really have to make sense of what information they have and try and make a decision, not by themselves, with their partner. And also to come back and speak to the urologist again if they need more information to help them make the decision. But it can be a very troubling time for patients.
This is often a dynamic process with patients. They may take several visits to the urologist and to yourself.
Absolutely.
Before they come to a decision on their treatment options.
And we encourage that. If they need to come back and get more information, we'll encourage them to do that. But we also try and make sure they're not just stalling. The longer people take to make a decision sometimes, the more difficult it can become. And often patients find they just go through a period of incredible worry until once they do make a decision about which treatment suits them best, they can, it's an enormous relief. They can then move to the next step, which is actually getting the treatment arranged. But we also work with psychologists, and they actually have strategies to help patients make decisions or move through the decision-making process if they really need to do that.
Okay. These days most patients we pick up with early prostate cancer, but there's still a large number who present with advanced prostate cancer that we can't unfortunately offer curative treatment. Yeah. How do you manage these patients and what options do they have?
Well, for those patients it's particularly troubling because they're often very distressed because they feel that they've not taken the steps they should have earlier to look after their health in the most productive way, or even worse, they sometimes felt they've been let down by the medical profession. They've gone to a GP who hasn't talked to them enough about why they should be being tested for prostate cancer, or even worse, has discouraged them from being tested. Anyway, these patients come along and they've usually got a lot of regrets. We talk to them about the treatment options, and also importantly talk to them about the side effects of their treatment. It's often hormone therapy perhaps if they require that to stop the prostate cancer activity, and that's not without some sort of quite significant side effects and significant changes to their lifestyle. So they need quite a lot of information about that, education, some counselling about how they can best deal with those side effects.
There for men who do have advanced prostate cancer, because This is still a chronic disease. Many men will have
Absolutely.
advanced prostate cancer for years. It can take time to come to terms with the diagnosis, but is there a lot of support out there, particularly in Melbourne, for these patients?
I think the amount of support that these men need is really only being truly realised in recent times. Things like the benefit of exercise, weight-bearing exercise for men who are having hormone therapy. We equate it to women going through menopause and all the changes they experience with hot flushes, weight gain, loss of libido perhaps, and all of these things men also experience, especially men in their early 50s, who sometimes these men are being diagnosed with advanced prostate cancer even as young as that. And they're sort of still seeing themselves in the prime of their lives, they're fit and active. And so the consequences of being started on hormone therapy can be particularly distressing. They do tend to gain weight, they lose some of their lean muscle mass, they become a bit lethargic, they gain weight around the abdomen, they can just become fatigued, just a whole lot of things, apart from the obvious things like experiencing the hot flushes, which they can find quite embarrassing. So we're trying to develop programs for these men, including exercise therapy programs, so that they can be directed to someone who can give them specific exercises which will assist them. We have also the psychologists. All these things can have quite an impact on patients' relationships too. And so they need to have someone they can talk to who can explain what they're experiencing, why they're experiencing it. Depression can be one of the consequences also. And if they're not aware of all those sort of things, if they're not told about that when they start this treatment, it can be bewildering. They don't know whether it's related to the treatment or not. So it's just a matter of making sure they have communication channels open with their treating urologist or the nurse or the GP if they're able to support them. But I still don't think there's enough support for these men out there.
The effects of any treatment for prostate cancer, and surgery is not without its complications and side effects.
Yeah.
And the two major ones are continence and potency. dysfunction, men often aren't comfortable talking about these issues.
No.
How do you approach this subject? Because most patients initially in the early stages after surgery will have some degree of erectile dysfunction.
Absolutely. And again, that's a very personal issue, and it involves much more a relationship. So I'm always very happy for the patient's wives or partner to be there, so they're part of that discussion as well, because clearly it's going to impact on them equally. We broach the subject prior to treatment, talk about the fact, are you sexually active? Some patients aren't. And if that's the case, well, that's perfectly fine. We just don't try and restore what they're not interested in.
Sure.
But for those patients who are sexually active, we talk about the impact, the fact that for a period of time, maybe up to 2 years after surgery, that they're going to have to use something to help them to get erections.
Okay.
And we actually are proactive. There's a program called Erectile Function Rehabilitation, a bit like doing pelvic floor exercises to get continence back. You have to use treatment to get your erections back.
This will be surprising to most men that there's a rehabilitation for erections.
That's right.
This has been shown to improve long-term function
Look,
after surgery.
There hasn't been enough research done in this area, but the little that's been done is clearly coming down on the side of use something to improve things. So we are far more proactive now in getting our patients involved in this earlier rather than later, and the evidence now is that even starting these medications prior to surgery will have some benefit.
Okay.
And I guess the only downside of all this is the cost issue. All of these treatments, be they tablets,
Yep.
the common ones Viagra, Levitra and Cialis, or injection therapy, there's a cost. They're not cheap, these
Sure.
drugs. Hi, my name's Helen Crowe. I'm one of the urology nurses at the Prostate Cancer Risk Information Clinic, which is based at the Australian Prostate Cancer Research Centre. We've started this clinic because we realise that there are some men out there who are not getting the information they need about prostate cancer and their risks. This is because GPs sometimes are confused themselves or just too busy to provide that information. So we've set up this clinic where men can just refer themselves, come along, spend about half to 3/4 of an hour with us. There are 3 of the nurses working there. And at that visit, we will give you some information about prostate cancer and about your personal risks and the pros and cons of being tested for prostate cancer. And then if you decide, we can actually conduct the testing, which involves a blood test and a simple DRE, which is a rectal examination just to feel the prostate. That information will then be given back to you and also to your GP with a recommendation from a urologist if we feel that either of those results are abnormal. We encourage you to come along and any of your friends. Thank you.